Everyone, myself Dr. K Katarria, and in this video we will be talking about the points stomach 13, 14, 15, 16, 17 and 18. So before going into the details about the indications and their function, let's have a look at their locations, as these points are located on the chest. So let's have a look. So in the last video we discussed about stomach 12 point, which lies in the middle of the clavicular bone, the collar bone itself. So if you just go directly below the stomach 12 point, that is stomach 13 point. Okay, so now moving on to stomach 14. Now how to locate it? The one way to locate is you go to CV20 or you go in the first intercostal space. So what is intercostal space? Let me explain you. So the space between the two ribs is known as intercostal space. So this is the first space. So in the first intercostal space, if you go fortune lateral to the midline, this is where stomach 14 lies. Just keep in mind that you have to move a bit because the ribs go a bit upwards in the upward direction. So you have to go along the rib cage. So just be cautious about that. So that's stomach 14 point for you. Now the other way to locate these points is you take a reference. In case of men or in females, you can take a reference point of stomach 17, as it is the nipples are located in the fourth intercostal space. So accordingly you can count the intercostal space and you can locate these points as well. So in the second intercostal space it's stomach 15, third is stomach 16, 17 is the nipple itself, and 18 is in the fifth intercostal space. So we have seen, and there are few caution you have to take, as these lie on the chest. So if you know needling, if you have an idea, you have a practice about it, then only you should needle these areas, because if you go too much deep you can puncture the lungs and it could be very risky. So you have to do transfer needling, not a perpendicular needling in this case. So let's have look at the point one by one. So stomach 13 is known as chi hu, meaning chi door. So why it's known as chi door? Because it's located in the uppermost portion of the lungs start from this point. And as we have seen in the last video, from stomach 9, 10, 11, all these points up till stomach 18, they all have the indications of descending the rebellious chi of the chest. So, and the other function you will be seeing that as a local point, because there is a location of breast in this portion. So most of the points will be covering, will be having the indication for treatment for the breast disease as well. So we have seen this stomach 13 point. Now stomach 14 is known as Tu Fang, and known as meaning the storehouse. Now why it is known as storehouse? Because the chest has the chest starts from stomach 14 itself. This is a starting point for the chest, and the chest acts as a storehouse of heart and lung, and hence the name. So stomach 15 is known as Va Yi, and it means the room canopy. Now from here the main lung, properly the lungs take their shape when they come into the second intercostal space. So as according in the 5 element theory, the 5 organs, if we compare, so lungs are there on the top and they act as a canopy. Okay, and the other reason is the breast also starts from this point, and this and it acts as a slanting roof, and hence the name. And this point has again the function of descending the rebellious chi, and it alleviates pain, and definitely it's going to benefit the breast. So let's move on to stomach 16. Stomach 16 is known as Yin Chuang, and it's known it means breast window. Why it is known? Because the chi and the milk pass through this point like a window. So this point acts as like a window. So you can correlate like all the ducts in the breast must be passing and must be collecting through this near this point, and hence the name. So it's again going to benefit the breast and this rebellious chi. Now coming to the point number stomach 17, known as Ru Zong, means middle of the breast. So it's the nipple itself, and hence it's very clear from the location itself. In this case, the needling is contraindicated, and there is no need to do moxa as well. That is also contraindicated. So let's see as the stomach 18 point. It is known as Ryugen, meaning breast root, as it is found below the breast fold, and hence the name due to its location. So this is one of the best points, local points for treating the breast disorders among all the points which we have seen. So why it is such an important point? Because let's understand the fact that breast is related to Yangmin, that is stomach channel, and the nipple is related to the Juyin, that is liver channel. So whatever is the cause of the breast disorder, or whatever is the indication, somewhere or the other these two channels must be involved, and we have to treat them only. So, and due to this reason, this point can regulate chi and blood of the whole breast. So as long as the chi and blood are in harmony and they are flowing towards the breast, there is no issue. The milk will be coming normally. And if the chi or blood there is some issue, then there is going to be some kind of problems like lump or some scanty lactation or pus, abscess, something like that, mastitis. Okay. So let's have a look what are the causes for it. So either it could be due to excess of the reason, or it could be due to the deficiency. So in excess, you will have symptoms like pain, distension, swelling and abscess, which can be due to liver chi stagnation, is the most common cause. Okay. So it has been seen that in the breastfeeding mothers, they are more prone to breast disorders if they consume cough producing foods, or if they are suffering from indigestion, or they are having some emotional issues, which generally leads to chi stagnation, leading to different kind of symptoms. Now the reason could be the external pathogenic factor affecting the breast, or it could be due to improper suckling by the newborn. Now in other words, we can also understand that if the breath of the baby is too hot, that can also leads to swelling and pain and stagnation in the breast, and most probably mostly in the stomach channel. So let's see the other cause, that is the deficiency. Now deficiency may lead to scanty lactation, which can be again due to the two reasons. The most common one is the deficiency of the chi and blood, which is mostly due to the deficiency of stomach and spleen. The other could be the liver chi stagnation. So in a nutshell, whatever is the cause of the whatever could be the cause due to excess or deficiency, you can go ahead with this point. It has a wonderful results. Thank you.